Tinnitus, that high-pitched noise or ringing in your ears that's so frustrating and sometimes even painful. It can interfere with every aspect of your life, even everyday things like mental focus and concentration, difficulty making conversation, causing you to limit your activities or even avoid social activities and events altogether. It may interfere with relaxation, quiet time, or even your sleep. Now, in the extreme, it can even cause anxiety and depression. Hi, this is Dr. T.K. Gossett, a chiropractic physician with extensive postgraduate study in orthopedics, neurology, and functional medicine, with over 35 years of clinical practice experience treating chronic and severe conditions. I'm here today to share some new developments in the treatment of tinnitus. Statistics tell us that nearly 1 in every 6 people in the U.S. suffer from this particular condition. Most typically, people with this condition have been exposed to loud noise causing auditory nerve damage and then tinnitus, as well as hearing loss. You may be unaware that virtually anything contributing to hearing loss can also cause tinnitus. It's important to know that other causes can be things like infection of the eyes, ears, nose, and throat, poor local circulation, autoimmune disease, even nerve irritation of the cervical or thoracic spine, which sends some secondary nerve supply up into the ear region itself. So yes, all of these can contribute to the development of or the progression of tinnitus as a disease process. So what do people with this condition do? Well, many patients are recommended medication, in-clinic or at-home physiotherapy, even behavioral modification for this condition. Unfortunately, often with mixed or no results. The important thing to understand is any and all causes of tinnitus, including those I just mentioned, must be uncovered, then specifically addressed in order for any treatment to be effective. And that's exactly what I focus on with each and every tinnitus patient. Once the causes are uncovered, then a specific treatment program for those causes need to be utilized to minimize or eliminate them. Now, there is a new exciting technology which provides real promise for effective treatment of tinnitus, and it's even backed up by new research data just recently published. It involves pulsed electromagnetic stimulation. Now, this has been brought to the forefront by new medical research that was performed with members of the VA, Veterans Administration, and recently published in the December 2015 edition of the Journal of the American Medical Association, otherwise known as JAMA. Now, this research project provided one half of the test subjects with a low-level concentration of this therapy, while the other half received placebo treatment. The results were impressive, with over 56% of the test subjects noting improvement in their tinnitus within 2 weeks, with long-lasting results even when questioned 6 months later. So what was amazing is I had already acquired this groundbreaking technology and already achieved similar results with this condition before even reading this research article. So you can only imagine how excited I was to have this validation by such a respected source as JAMA and with this group of veterans. So the good news is this therapy is available now for those suffering and ready to take action to free themselves of the painful and frustrating symptoms of tinnitus. Because of my particular background in education and clinical experience, combined with continual interest in new research and newly developed medical technology, plus my willingness to invest in them, I am uniquely positioned to develop revolutionary treatment protocols for many different types of chronic and severe conditions, including tinnitus. Now, the program I've developed for tinnitus specifically is a 3-step protocol which reestablishes the normal cell function and stimulates the healing process within the middle ear. It includes the PEMF to reestablish the normal electrical activity in the nerve cells of the inner ear, neurocranial integration, gentle manual therapy to normalize the local circulation of the spinal fluid. This provides higher levels of oxygen and nutrients to the nerve cells of the inner ear. And then number 3, neuromuscular rehabilitation. Rehabilitation to rebalance the brain, its hemispheres, and the neural pathways connected to the middle ear. This locks in the treatment and improves long-lasting. Because I am a chiropractic physician in solo practice and have the freedom under the Illinois statute to practice medicine in all its branches without the use of drugs or surgery, I have the freedom to develop treatment protocols comprised of a primary research therapy like PEMF, then also include complementary therapies based on past clinical experience and medical research, and then adjust the treatment settings for each individual patient rather than use a cookie-cutter approach of one therapy with one specific setting as presented in these research. So what does that mean for you? It means an individualized treatment for each patient, resulting in a deeper, more complete healing process and with a longer lasting result. My evaluation and treatment approach to resistive chronic conditions is known as the Gossett factor. It involves using established and often overlooked examination procedures to uncover the root cause of these conditions, then using newly developed research technology with specific protocols which are individualized for each patient. So it's my experience that this revolutionary approach is what truly assists patients in achieving a transformation in their health and their quality of life, essentially getting their lives back. So here's my question to you. Why wait 10 years for multiple research projects to approve this therapy as a gold standard when you can have the symptoms of your chronic condition like this reduced or eliminated within a relatively short period of time right now? Hearing this information is good, but you're going to have to take some action in order to change your situation and your tinnitus condition. Your next step is to set up a consultation with me. Now, this consultation is to review your medical history, help me determine if I can help you as a patient to receive this 3-step protocol for tinnitus. The fee for this consultation is $147. In order to help patients further, I'm willing to credit the consultation fee toward the cost of any recommended treatment program. Because this research and technology is so new, it's not covered by any insurance. However, special payment options are available. Another benefit I offer in some cases is you may be able to even start treatment the same day as your initial consultation. As you would expect though, spaces are limited and I can only make this offer available to the first 10 patients who qualify with this condition. So opt in now to reserve your appointment time and start the process of taking charge of your life. It's important to note this type of therapy is contraindicated for individuals with implanted pacemakers or other electronic medical devices. But hearing aids are okay because they can be removed during the therapy. In closing, this is Dr. Gossett, and I hope this information is truly giving you some new hope. I look forward to meeting you soon.